First statement to make before we start
I
asking
do.
questions? All right.
Thank you. All right. Okay, good afternoon, everyone, and thank you very much for this opportunity. My name is Dr. Mark Vooght. I'm Medical Health Officer for Moose Jaw. I'm also the Saskatchewan Health Authority lead for this particular issue. You have the PSA in front of you, and if you need copies, just ask Lisa for that, please. So the Health Authority, Saskatchewan Health Authority, has confirmed a case of measles in Yorkton. And this is a recent traveller who returned to Saskatchewan, flew through the Regina airport on June the 9th after overseas travel. And so having confirmed this case of measles, the SHA is issuing an exposure alert for those individuals who traveled on specific flights, through specific airports, and as well as through the Yorkton Regional Health Centre, and this on June the 9th. And those details were outlined in the PSA. So measles is a very contagious organism. It's a virus, it's a respiratory virus, and we are most concerned about reaching those people, specifically passengers and crew, travelers, area residents who may have had contact with this case. This is the reason why. Some people may benefit from preventative treatment if this is given within 6 days of exposure. And the important thing to note here, please, is that this time frame ends this Saturday. The people who would benefit include infants, people who are immunosuppressed, those who are unimmunized for measles, including especially pregnant women. So that time frame ends on Saturday, and I really want to emphasize that. It should be the minimum number of people who require this, but the time frame ends on Saturday. I'd like to talk for a second about those who become ill with measles. We're not expecting anyone, hopefully, to become ill with measles. But if someone does become ill with measles, they likely develop symptoms within 7 to 21 days of being exposed. Symptoms of measles include fever and rash, red eyes, runny nose, and a cough. The important piece here is that if someone does develop symptoms and they wish, then they should see their healthcare practitioner. It's absolutely crucial that they phone ahead first and make contact with the healthcare practitioner so the necessary infection control measures can be taken. This is very important so that people are not infected, others are not infected. If you've been to any of the exposure alert areas and you're unsure of your vaccination status for measles, then please contact your local public health office or your local travel health centre for further information. In general, more information is available on the SHA website. Thank you again for this opportunity, and I'd like to ask if you have any questions or want to discuss any issues.
Does SaskHealth have any kind of estimate on how many people may have been exposed between the flights going through the airport and getting to the Yorkton Regional Health Facilities?
That is currently being established. I don't have a figure for you right now.
What do you think that the chances are of this turning into a wider outbreak, just kind of given how many people potentially have been exposed?
On the one hand, measles is a very contagious organism. It's a virus. On the other hand, fortunately, this family went straight to the emergency room in Yorkton from the Regina airport, which reduced the number of exposed persons. And therefore, I think that it may be limited in its impact and severity. We have also made a lot of effort in Saskatchewan over the years to have all our staff fully immunized, and that includes for measles, and that requires 2 vaccinations with measles-containing vaccine.
Do you have anyone under observation or being tested right now that may have been close with this person, or that may have come into contact with them?
We have established that the family of this specific patient is fully protected against measles, so that's incredibly good news. We do not have any knowledge of anyone else having developed symptoms, and to be honest, it's a little too soon for exposed people to have developed symptoms because they usually take from between 1 to 3 weeks in the outset to develop symptoms.
What can you tell us about the person infected? Was it a kid? Was it an adult?
I can tell you it is a very young child.
And how are they doing right now?
The child is doing well.
Can you walk me through the last 4 days? What's the timeline been like? What's happened since you found out it might be measles?
Actually, we found out late on Tuesday evening that it was a confirmed case of measles, and we did further testing, actually. We only had a blood test at that time, and the medical health officer involved did organized a lot of extra testing, and we subsequently confirmed that it was definitely a case of measles, and that was only confirmed last night, actually.
Was this child vaccinated, and if not, do we know why not?
This child was not vaccinated against measles because, as I said, this is a very young child.
What's your message for people regarding vaccinations? You know, it seems to be a big debate to some people.
Absolutely. I think not only in the cases we've seen in Canada, but across the world with measles and other vaccine-preventable diseases, we've seen cluster outbreaks. We've seen actually quite massive outbreaks. For example, in the case of measles in Europe, ongoing in Africa, Asia. So the message is to get yourself vaccinated against these diseases. Measles being an excellent example, being very infectious.
Do you have...
For confirmation's sake.
Could you repeat the question, please?
Just with this being a very young child, would they be too young to have received the MMR vaccine?
This child was too young to have received the vaccine in the normal standard MMR schedule. The measles-containing vaccine they would receive is at 12 and 18 months usually. Special provision can be made to give it to children as young as 6 to 11 months, but that requires consultation with the local public health unit. And so my message is people with young children, even if they are under the age of 12 months, can consult with public health, and please do, to see if your child is eligible for an early shot of measles-containing vaccine.
Do you have any data on how wide our coverage right now is for people being vaccinated? How well prepared are we for something like this?
We know that by 2 years of age in Saskatchewan, approximately 90 to 91% of children at 2 years of age are vaccinated, which is quite good. However, we also know that we need to boost that up to at least 95+% to be able to fairly safely be able to prevent outbreaks occurring of measles.
So are we at higher risk now, given that we haven't yet achieved that 95% threshold?
We're always at some risk if we're not at 95+ coverage rate. So there remains a risk of spread within a community.
We're probably going to presume, given what you said, that they were too young to be vaccinated, and 12 months is the cutoff. Are they less than 12 months? Are you able to tell us that?
Sorry, could you just
Are they in
repeat
fact
the
less
question?
than 12 months? I'm just kind of guessing based on what you've said earlier. That
Are you
this
talking
child
about the
is less than
specific
12 months.
patient?
Yes, this patient.
This patient is an infant.
An infant. Okay.
I'll just leave it at that.
Sure.
Thank you.
And are we able to know, I think it might be obvious because they were traveling, but they got the measles overseas by the sounds of it?
Yes, with the incubation period and so on, we're confident that they developed this disease overseas. They contracted it overseas and began to be ill just before returning back to Canada.
Okay. Anybody?
Would you just get the proper spelling of your name and your title if you could?
Absolutely. My first name is Mark, and my last name is Vooght, which is V like Victor, Vooght, Medical Health Officer for Moose Jaw, and I have responsibilities in the specific area of communicable diseases, specifically measles.
Great. And C for Mark or K for Mark?
MARK.
Great. Thanks.
Thank you very much.
Well, thank you for the opportunity again.